A live look this morning at one place in the hospital few people get to see. Well, unless you work in one or you're having a procedure in one. Nurses, doctors, and staff are prepping for a day of back-to-back surgeries. 1 in 5 nurses nationwide have left the healthcare field. But for us here at the University of Kansas Health System, it's not a matter of people leaving, but it's that we're adding more opportunities through our growth here at the health system. But what does it take to be a nurse, and the outlook as the COVID pandemic enters its 3rd year, and what it means for the future of the healthcare field? The Morning Medical Update starts right now. Good Tuesday morning to everyone. It is March 22nd, and thank you for joining us here on Facebook, YouTube, and on Twitter. Coming up today, as we mentioned here off the top, we are going behind the scenes into one of the busiest places here in the health system, the operating room. We're going to show you just how important nurses are for the team up in the OR department. We will also explain why there is such a demand for nurses right now. So let's get to it, and let's get up to Alexis Del Cid, who is joining us outside one of our operating rooms this morning. Good morning to you, Alexis. I know when I go upstairs and do stories up in the OR, I always feel like I'm just standing around doing nothing because everyone is so busy. I always feel so useless because everyone is so hard at work.
Hey, I'm just trying to stay out of the way, Jess.
Right?
This place is buzzing. I mean, there's never a time where it's not busy. I'm here in the OR. This is kind of the nerve center of the OR. We're going to be very strategic about what we show you because there are patients going back and forth, so to protect patient safety. But this is the control desk. This is where everyone reports for their shift. Behind me, this would be the equivalent of, say, an assignment board in a newsroom. So every single one of these is an operating room, and these are all the nurses and the techs who are assigned to the operating room. They even have these magnet tiles. This indicates if one of the ORs needs blood somewhere. And I mean, people are coming here nonstop. The surgeries are back to back to back, anything from something that's routine to something that is a very urgent matter. One thing I can tell you is this is a high energy place to work. And you can just feel that this place is a team. This is like a hive where they're just all buzzing around, working together. Everybody knows where they need to be. Coming up, I am so excited to introduce you to 2 different nurses who have 2 very different specialties. They're friends, they're teammates, and they each talk about what it means to them to be a nurse and what it takes to be a nurse, and even more specifically, what they're looking for in new teammates that they hope join them here at the University of Kansas Health System. This is just the coolest place to be. Got to say, as far as arriving somewhere early in the morning, there's a lot of energy in this workspace.
I know, you feel just a little more important when you have scrubs on, don't you?
Yeah, absolutely, Jess. I mean, between this, the mask, and the scrubs, I feel like I could definitely watch a procedure.
I think so. You could watch one. You could observe one from a
else.
very far distance. All right, you look
Right,
official, and we
right.
look
That's
forward
where I
to
should
us.
be.
We look forward to seeing you again and meeting those nurses here in just a bit. So we'll check back with you in a few moments. But let's get to some medical headlines this morning. Dr. Hawkinson, this will make you happy. 3 out of 4 people say they will return to masking up if COVID or other viral infections increase. The poll taken March 14th by Axios found that right now only a quarter of people still wear their masks all the time when they leave the house. The same poll found that 66% of those surveyed say that they are optimistic we will return back to normal. A drug hailed by some as a miracle cure to COVID-19 is nothing really but coronavirus snake oil. We've talked about this. That's according to a peer-reviewed study of ivermectin by McMaster's University in Canada. The researchers found that COVID patients at risk of severe illness who received ivermectin did absolutely no better than those prescribed a placebo. A visit with a friendly dog may be just what the doctor ordered for patients coming to the hospital or the emergency room. Researchers in Canada found patients in the ER who spent just 10 minutes with a trained therapy dog reported less pain, less anxiety and depression, and improved well-being all over. The study was published in the journal PLOS ONE. And a major recall for those who use hand lotions. Check this out. Jergens is recalling its 3 and 10 ounce ultra healing moisturizer because they could contain possible bacterial infection. The FDA says this could, as you can imagine, cause a big issue for immunocompromised people. It was made between October 1st and October 19th of last year. The company is urging people to stop using the lotion. If you think you have it, do that immediately and contact Jergens for a replacement. Get your questions sent into us this morning on YouTube, Facebook, and the Medical News Network, and also on Twitter. You can find links to all those right there on your screen. Yeah. All right, let's get to Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joining us hopefully with some continued good numbers. Good morning to you.
Yeah, continued good numbers. Not the best. We still hope our active infections would be down lower than they are. We've kind of settled into the teens right now of our 7-day rolling average for active infections. Right now we have 14 active infections, 2 in the ICU and none on the ventilator, still 64 in that recovery period, a total of 78. But again, Jess, we were hoping the active infections would go down to those single digits or really none. It's holding steady, but at least it's not going up right now.
All right, thank you for that. We'll get back with you here in just a few moments. Let's check and see if we have any reporter questions on the line today. We good? All right, we're going to move on. Jump back in if you do have one. Okay, so let's get to our topic today. From surgeries to emergency room visits to every procedure and doctor's visit in between. There isn't a day that the hallways and rooms here at the health system are not full of staff and people. And we are looking for highly qualified nurses to be a part of this team. There are 2 job fairs in the next couple of weeks, and we know a lot of you have questions about what it is like to work here and in other places like ours, and what it's like to take care of patients, and certainly in a time of COVID during a pandemic. Joining us in studio this morning is Rachel Pepper. She is Chief Nursing Officer for the Kansas City Division of the Health System, and Gail Schuetz. She is the Assistant Chief Nursing Officer for Inpatient and Emergency Services. Always good to see your faces. How are you?
Good morning. Good. Really good. Thanks.
Good to see you both. Okay, so we know that operating rooms are packed across the metro. We're going to see inside ours here throughout the morning. Let's talk about how the demand is not only affecting our healthcare system here at our hospital, but really all over. Rachel?
Yeah, that's so true. There are people who throughout the pandemic were a little more hesitant to come out and get care, maybe delayed a procedure or a visit, and those people are coming, and both to us and other places, keeping us very busy, as well as, people who just need their day-to-day healthcare needs met, and we're glad to take care of all of them.
So, Gail, what have you noticed? I mean, as Rachel mentioned, people putting off, and so now we're seeing the effects of people coming back in, which we definitely like to see. We like it to be busy because we know people are taking care of themselves. What is your insight? What are you noticing?
Sure. I think it's just a very busy place right now. And as Rachel mentioned, we have patients that are coming in for surgical procedures that may have been delayed or postponed during the height of the pandemic. And honestly, people heeded warnings from people like Dr. Hawkinson to say that you should stay home and try and avoid being out in public if at all possible. And now as numbers have gone down, people are more comfortable getting out, seeing their doctor, and having those procedures and tests and that health care that they just put off for so many months. So we're happy to have people showing back up to our place, and we're more than happy to take care of them and provide them excellent care.
All right, we are going to get back up to Alexis. Dr. Sean Coomer is standing by right now because I know he's got a procedure that is just about to start. So we wanted to check in with him, Alexis, and just find out from him just what these nurses really mean to these doctors and why they're so important to our team.
Right, I'm excited that we were able to grab Dr. Sean Coomer before he went into the operating room. Where are you headed after this? We just saw you running down the hallway.
We're doing a laparoscopic donor nephrectomy. Someone is donating their kidney altruistically to someone, so it's a big day today.
And Dr. Coomer is the transplant surgeon. He's the vice president of operative services. You're the first to say, hey, forget about me. The nurses are the heart and soul of what you do. What does it mean to have such a team like this that surrounds you every day?
Yeah, I think one of the things about nursing is so diverse across the entire health system, right? There's so many different things and different workflows. When you think about peri-op and procedural services, we have one nurse and one tech in every single room. So it's all dedicated to that one patient. So it is so vital that for them, they're one leg of that stool to take care of that one person. So it's very important.
If you had to describe in a nutshell the kind of teammates that you're looking for here to join your team as nurses, what does it take?
Oh, it's team player, right? So it's a team player ready to roll with the punches. It's a high-paced, high efficiency, tough area to work in, but it is so exciting and so rewarding so quickly. So it's a great place to work.
Dr. Coomer, thanks for taking time out of your busy day. I know you've got a surgery to perform. We're actually going to call in 2 of your nurses right now. We have Ellen Chrissy and Katie Poninsky. He's He's going to scram. He's got to go to surgery. We're being careful at the angles we show again because you never know when a patient might be coming down this corridor on their way to a surgery. So right now we have Katie Poninsky and we have Ellen Chrissy here. Now you two are very different kinds of nurses. You have different specialties. What's your specialty?
I work on the general team, and I'm also on our liver transplant specialty team.
Liver transplant specialty. That's
So I work
exciting.
with Dr. Coomer a lot.
Right? And you have a nickname for him.
Well, we have Super Coomer. I know
Coomer.
when they did the COVID vaccines and the flu shots, they had a billboard up that he probably loves seeing all the time.
He says you guys heckle him. What I love about this team is what a good camaraderie that they all have. And I want to ask Ellen. Ellen, what is your specialty?
I work in plastic surgery.
That's got to be so exciting, both of your jobs. Is there ever a routine day, or is always you show up and you kind of never know what kind of excitement's going to be thrown your way?
I would say for the most part, we know the surgeries we're going to be doing for that day. However, at any moment, that could change.
Right.
So if we get done with the surgeries scheduled, you could get thrown into, a trauma if something comes up, and you just kind of have to be on your feet and be prepared to do anything that's needed of you.
And Katie, that's something that you were saying before the show began, is that these team players have to be ready at a moment's notice to jump in and help their friends. I mean, these are kind of your friends and family as well as your coworkers.
Yeah, we all work together very well. We have traumas that can roll in. From the board behind us, we have people that are free throughout the day, so if something does come in, either a trauma or an emergent surgery that's within the hospital, you're never alone in those rooms. You always have 3 or 4 other people in there. Everybody's always coming in, checking on you throughout the case, making sure if you need help. We definitely work on a very good teamwork, and then days that we might be a little short or staffing might look a little tight, we all work so well together that people are willing to always pick up and be here. You're essentially helping out your friends,
Right.
To help make a better day happen.
It's incredible to see, and you can feel that vibe when we walk. The minute the elevator doors open, we walked onto this floor, you can just feel that this is a group that cares about each other, and you just feel that kind of that symbiotic, the way you guys work together. What is the most rewarding part for you at the end of the day when you get home or you take off your scrubs and you sit down on your couch?
I would say just being there for our patients when they're at their most vulnerable. Our patients are asleep. They can't speak for themselves. So being that patient advocate when no one else can, and just being there for our patients, holding their hand when they go to sleep, and just being there.
Had you always known that you wanted to be a nurse?
Since my junior year in high school, I knew this is where I wanted to do. I knew exactly I wanted to be in the OR. This is where I wanted to be.
And what about you?
Yeah, same. In high school, I knew I wanted to go into the nursing field. I knew it had a lot of opportunity and a lot of different avenues you could take, and I found myself in the operating room, and I wouldn't want to do anything else.
How long have you been a nurse working here with the health system?
Almost 6 years.
And what about you, Katie?
I've been here just shy of a year and a half. I did 8 months on our trauma unit, and then I transferred down here last February, so I've been down here for at least a year.
I want to ask you a question that's really important for people watching to know about, because there are 2 job fairs coming up for nurses. I'll start with you, Katie. What is the kind of teammate that you are looking for?
I want someone that's willing to come in, step up, help where there's needed for help. Someone who, throw them in a room, they just go with it. Sometimes what we do is hard, sometimes what it's not, and I think just having someone who's willing to be very flexible.
And Alan, when you think about the next group of teammates that come in and are joining you in the operating room, the people you see first thing in the morning, last people you see at night, what kind of person do you want to work with?
Just a positive attitude, having a positive attitude every day, no matter what's thrown at you, just showing up and ready to work, and working with a sense of urgency and being willing to help your teammates and being there for each other. We're all one team, and just being a team player.
Alan and Katie, thank you so much. When I toss it back to you in the studio, Jess, one of the other things that is so special about being in this environment is knowing that the people that surround us right now, and Cliff Irwin, who's the guy holding the camera now, we walk up and we know we're surrounded by a team that is so respected and so loved. Nurses across the community are known as being the people you can count on, the people that you see, and the people who really have that bedside manner that you trust to hold your hand throughout the whole thing. And it's just a very special place to be, and you can really feel the energy. Thank you both so much for joining us and sharing a little bit about your day. Now, do you both have procedures coming up right now?
Yes.
Okay, so you got to go?
Yes, same.
All right. You are free. Thank you so much for joining us. I'm going to toss it back to you in the studio.
All right, Alexis, thanks so much. Try to stay out of the way.
I'm trying.
Okay.
I'm just trying to stay in my corner so that I don't trip anyone or bump into anyone.
Well, thank you for that. That behind the scenes look. Again, not a place you get to see, and talk to these nurses and find out what they're doing on a daily basis. I want to talk to Rachel and Gail again. A word, we talked about really the heart and soul. I don't think you're going to get a doctor here to disagree that nurses are truly the backbone of our health system. They simply are. We use the word grit. We've used that word a lot. I know that is your word when we talk about nurses. Talk to me a little bit about the culture, and when you see the nurses that we just spoke to, tell us a little bit about the nurses, the men and women that care for our patients, and what it takes to be one of those people.
I'd love to, and seeing the OR nurses talk today, it just warms my heart. It's so special what they say, because I think it captures the essence of who our team is and what they do. Our nurses care so very much, and they're engaged. They give it their all every single day, and they're also really, really skilled. So our nurses are just such an important part of the team and make our place what it is.
Hey, Gail, they've been put to the test the last 2 years, but I feel like they were prepped and ready, just because of the people they are and the kind of work they do and how they come through these doors every day at our place and at really any hospital that you've heard from throughout this pandemic. But how has the pandemic really pushed these people to better their craft and better care for patients?
Yeah, I think the teamwork, as the OR nurses mentioned, is just so critical. I think any nurse that you speak to in our organization will speak to the teamwork, whether it's the teamwork amongst the nurses or the teamwork with the physicians, the pharmacists, you name it. They're working all together as a team, and that just became really, really critical during the pandemic, because people were stressed and dealing with the pandemic not only at work but at home, and so that teamwork at work became all the more critical. Also, our patients were scared at the same time that our staff were scared, at the same time that our whole teams were scared when COVID first came. And so I think they really just coalesced, and that foundation of teamwork that was so strong before the pandemic really just came together in a way to help them really get through it.
I want to talk about these opportunities that we're seeing in nursing here and really nationwide. It was mentioned at the top of the show, 1 in 5 nurses are leaving the healthcare industry. We don't like to hear that. We know a lot are looking to get into the healthcare field as well. We attribute a lot of those openings and opportunities here due to the growth of our health system. Let's talk about that and how that's brought many opportunities to aspiring nurses everywhere.
Sure. This is an exciting time of year for us. There are a couple of times a year where there are a lot of nurses looking for jobs that are graduating from nursing school. So in the springtime and then again in the winter, we have an opportunity really to hire nurses that are excited to get into the field. And, we've had a lot of growth. We opened 100 new beds over the pandemic, and we're super excited this time of year really to just feel the excitement of the new graduate nurses and interviewing people and people starting their nursing career. This group of nurses that will be graduating had their entire experience during a pandemic, and so I'm just excited to get them on board, get to know them, have them feel how amazing it is to work with our teams. And we have lots of opportunities in healthcare and a lot of different opportunities for nurses. So I couldn't be more excited. I'm excited for the job fairs to find those people that haven't quite found what they want to do when they graduate, or experienced staff that may be looking to do something different. It's just a really bright and exciting time for us. It's always nice in the springtime because the weather and the longer sunshine days go along with this sort of refresh of getting the graduate nurses, and so it's a really exciting time
Definitely,
for us.
things are turning over.
Absolutely.
Truly. Okay, Rachel, I want to get with you in just a second, but I do want to tell people about the QR code that's on the screen so people know a little bit more about the job fairs and how that they can participate in those. So 2 hiring fairs happening this week and next, so you can just hover your phone, your camera over the QR code that's right there on your screen, and you'll be able to get some more information about times and where. And I know this is the first job fair that we're having that's in person since the start of the pandemic. That certainly says a lot, right?
We're so excited to be having job fairs and having people come back in and interact with us in person and learn about our place and tell us about them and why they want to join our team. It's going to be a lot of fun.
There's something about that in person. Yes, you'll only see half of their faces because masks will be required, but still just knowing that you can smile through the masks and see people and kind of feel that love and feel that vibe, and certainly new opportunities. That's what this is all about. Let's talk a little bit more about, I want to go back to kind of the culture, Rachel. We've talked so many times about what it takes to be a nurse here. Tell me about that. And then I want to talk about some of your special nursing stories that you have.
Sure. I think this is the most special place to be a nurse. Nurses are highly valued. There's so many places within our health system that nurses can work and contribute in such great ways. And as you've heard throughout several people's comments today, we truly work as a team, and the nurse is such an important member of that team. So I think it is the best place to work. We're always focused on the patients having the best experience and truly the most safe care, and encouraging the families and friends to be part of that experience. And I think that's what makes it special here. Nurses form those relationships and give really, really skilled care, and they're an important part of our team every day.
All right, it is story time. I love story time here on the Morning Medical Update. So who wants to go first? I want to hear a really good nursing story. Gail?
I can go first. So I have a favorite.
And you told me yesterday, you said this is like picking your favorite child.
Yes,
it's hard to pick your favorite nursing
This is
story.
definitely not easy, but one time we had a patient that showed up with their dog, and I'm a dog lover, so this will always be a special story in my heart. But the patient didn't have someone to pick up their dog immediately, and so the nurses for more than a day, maybe even 2 days, cared for this patient and her dog. Of course, the patient didn't come with supplies for the dog, so the nurses made that happen. They made a leash out of some IV tubing. They took the dog out for walks. It's just amazing. And then finally, a family member was able to come and collect the dog. But it's just, for every one story like that, there are 1,000 that I don't know about. And I think, when you mentioned that we would tell a story today, I thought, gosh, there are just so many amazing stories. And then there are all the thousands of little stories that really make up why it's so amazing to work in healthcare, why it's amazing to be a nurse, whether it's the ringing of the bell in the cancer center to signify the end of the treatment, or the pregnancy that never thought would happening in one of our infertility clinics, or the patient that got cured of their disease or had a liver transplant or a kidney transplant. Those things are life-changing to our patients, and there are just nurses involved in every single part of that, very special pieces of people's lives. And so I think, there's the fun stories like taking care of the dog, but there's just so many that happen every single day that I think are really the miracle and the special stories of healthcare.
So making leashes out of IV tubes, that is not in the nursing handbook.
It is not. Nurses are very clever, though. They will craft about anything out of whatever it needs to get the job done.
Well, they figure it out, just how we've made that comparison during this pandemic. I mean, this wasn't something that really, although it caught so many of us regular people off guard, really this was just their call to their moment, it feels like, right? And Gail mentioned it, Rachel, but it's those relationships. You can't ask a nurse, tell me kind of the average day in a life, because every single day is different. Every person is different, every patient, every relationship, right?
So true. It's true. And I would add on to Gail's comments, there's no way to pick one story. I thought about this a lot. And
well, and I texted you both yesterday. I said, come with a story. And I go, I know they're both going to go, one story? How can I come up with one story? I said, okay, maybe two if there's time. Okay, but what's one that just kind of floats to the top for you?
So I would say, one of the best parts of Gail's and my job is we get to visit with a lot of patients and families who want to tell us about the care that the nurses give. And so I'm not going to give one, but I'll give a tiny piece of just 3 or 4 things that come to my mind.
Okay.
Every single week when I talk to people, I'm always struck that it's ordinary and extraordinary that matter to people. And Gail alluded to that. Last week, someone was talking to me about the nurse and nurse aide team making sure the bath supplies were warm, so it was really comfortable for their family member to get their bath. And then I think about the things that happen, the nursing teams hosting birthday parties for little bitty kids when their parents are too ill to do it, or helping a person be a little part of a wedding, even if it's from their hospital room when they can't attend. There are countless stories like that, and every single time I'm totally awestruck when I hear them, and I'm so proud of the nursing team, and I think it's what makes it special to be here, to be part of that team and to care about patients in the way our nurses do.
I'm going to get to some community questions, if we can. So, Joe Ellen wants to know what education was required for our guests today. So maybe kind of tell us about your education path to get to being able to do this dream job of yours. Gail?
Sure, I have a really interesting educational and career path, I think, for my position. I started here at KU in the neonatal intensive care unit as a PRN nurse in 1997. So I just had my 25th year anniversary here. I had my bachelor's degree to get that job, my bachelor's in nursing. And then I went back to school and got my master's degree and became a nurse practitioner. So that's where my advanced education came. And then I just got interested in nursing leadership. And after having that advanced nursing degree, that opened up a lot of doors for me to be able to do some different leadership positions throughout the hospital. And then expanded my career into this role a couple of years ago and have really enjoyed learning about all the different types of healthcare outside of the neonatal intensive care unit, although I do miss the little babies just a little bit.
I know, but you're a grandma now, which is another thing. She's been here 25 years and she's a grandmother. Hard to believe. Yes, let's just point that out. Joe Ellen wants to also know, what was your least favorite high school subject? And maybe what was your favorite?
Oh gosh, I really loved math and science, so that's
makes sense.
Yeah, absolutely makes sense. Probably didn't love like Spanish or the English classes as much. But math and science were definitely my favorite.
Those were my hardest. See, and I was English. Okay, so you guys are the smart, sciencey ones. What was your favorite and least favorite?
My favorite was also the math and science, and probably more the history and English were a little bit less my favorites at the time.
Okay, we can tutor each other. Okay, so tell me about your education path.
Sure. I too have had a really fun journey along the way. I've been at the health system the past 19 or so years, and I came here as a brand new graduate nurse and was bachelor's prepared and worked on our cardiology and progressive care areas. And, you know, something really special and cool about being a nurse here is advancing your education is really encouraged. And so I gathered with different nurses that I was working with, and we entered into a master's program at KU, and I completed both a master's and a DNP, a Doctor of Nursing Practice here at KU, and then through the years did different roles in the health system, charge nurse and nurse manager and nurse director, and more recently in this job. But, you know, always along the way, loving interacting with the patients and the nurses. I think any role you're in our health system, it's about the patients and it's about the team, and it's just a great thing.
Well, and it says a lot when we talk about a quarter of a century that you've been here at the health system. That has to say a lot, because you can go lots of places. Absolutely. You've done the work, you have the education, and you can go anywhere. But what I hear you say is you're taking different paths and different ways to get to becoming what you want to be. It's that support here that's helped make you say, well, no, I don't want to go somewhere else. I want to stay here and just find my path here. So I love that.
So
I want to check in with Alexis, because she's got two of our nurses standing by in our OR. Alexis, I want to go up to you. That was a question from Joe Ellen, and I do want to go ahead and ask your nurses standing by just what their path was to get to where they are today.
Joe Ellen read our minds up here, because we were just talking about that, of what your paths were. Let's start with Katie.
So I went to Girard High School, if we want to go all the way back there. I then went to Pittsburgh State University, which is in Southeast Kansas. I graduated with my bachelor's degree there, and I will be starting again this June for my doctorate of nurse practitioner.
Wow. And Ellen, what was your path?
So I went to Blue Valley High School, and we had a program called Exploring Health Professions. So I got to shadow nurses, and that's when I discovered I wanted to go into nursing. I went to University of Central Missouri, and then I got the opportunity to interview with KU for a couple different nursing positions, and I just fell in love with the OR staff. I had a group interview, and they were all so kind, and I got to shadow in the OR, and that was it. I knew I wanted to be here.
Yeah, this is interesting because, Jess, we're talking about, how they got their start and they were inspired in high school or in college. But Katie, your mom is a junior high teacher.
Yes.
And her class is watching you right now on the morning medical update, 7th and 8th graders. So that could be an inspiration. You want to give them a shout out at what school or what school is watching?
Gerard Middle School. Hi, Mom.
And it's Mrs. Pitts?
Yep.
Okay, Mrs. Pitts, you are awesome. Thank you for inspiring your class. And you've got a great daughter.
Yes, Mrs. Pitts and all of her future nurses who are watching this morning.
Yes.
I love a good shout out. Okay, we'll check back in just a couple of minutes. A question I have, actually, Dr. Hawkinson, I'm just going to switch over to you really quick. Let's see. Why are the numbers of recovering patients from COVID not going down and staying so high? Jean wants to know.
Yeah, I think there's a lot of factors there. Number one, it is probably patients that were here for actually having COVID symptoms. Maybe they were in the ICU at one point. Maybe they're here for other reasons. Still, like needing oxygen placement, things of that nature. But also, are they patients who came in and were found to have a positive PCR test as well, and were undergoing other procedures, or here for other reasons as well? So there's a variety of factors there. We don't have all of that teased out just because of the pure numbers about that. But, we do know that when people come in and they are severely ill, they can be here for a while. So I think it is a combination of those people that are still recovering, that still are not optimized to be discharged, but also that issue of where people came in, were found to be positive for one thing, and maybe they're still here for something else as well. So I think it's a combination of those factors, and that's why we're really looking at and focusing on those active infections that come in.
Right, makes sense. Question from Isaac. Are there certain times of the year when you expect the OR to be busier? For example, the couple of weeks following 4th of July due to people coming in from injuries. Just any insight from our panel today?
Sure, I can take that one. Definitely the end of the year tends to be a really busy time. Insurance largely drives that. People have met their deductible and they want to get any kind of procedures done before the end of the year. So while some people may be relaxing in that last month of the year and trying to calm before the new year starts, it's very busy in the ORs at that time of year. And then I think it picks up in the summer a little bit when people are out of school, kids are home from school, any kinds of procedures that needed to happen, they didn't want to miss school, will kind of pick up during that time.
Jade wants to know about continued education for nurses. So somebody clicks on our QR code, comes to our fair, is lucky enough to come work here. What kind of continued education will they need to follow?
Well, there's lots of opportunities to get continuing education. We have a culture rich in that. Our teams have the ability to access many different offerings that we have in our health system to learn and to grow, as well as connecting with external opportunities. There's also very formal ways, as I mentioned, academic progression and tuition assistance that we provide so that people can return to school and pursue additional degrees in advanced studies.
Dr. Hawkinson, I forgot to ask you your favorite subject in school and your least favorite subject in school.
High school was so long ago. I don't know. I know for my kids, their favorite subject is lunch, and it just kind of...
That's what my kids say, lunch and recess. You do not have a favorite subject in high school? What were you really good at? Please say science.
Probably
Please say
not
science.
That much. Yeah, science, biology.
Okay, I would hope so.
It wasn't math, unfortunately.
Right,
I wish
I know.
it was.
All right, let's get to some final thoughts from our guests today. Rachel, I'll let you get us started. Just what do you want folks to know who are looking for an opportunity in nursing anywhere, especially here, though, at the health system?
Sure. I'm really proud of our team and so grateful for the amazing care they give every day. And I think it's an exciting time. We're adding to our team, and we want awesome people to come join us who want to be part of something really special. And we're excited to meet you and to see you join our team, and we'll all grow stronger together.
Gail, what do you want us to know?
Sure. I know people have a lot of choices of where to go and work when they get out of school, and we would just be so honored to have you consider our place. we think that you will find it to be a very special place, as Rachel mentioned. If you love academic medicine, doing things that maybe aren't done at other places, this is a place to come. It's a very patient first, safety first culture here, and we would love to have you join our teams. Please come to one of the job fairs, reach out in any way possible. We would love to meet you, get to know you a little bit, and find you the perfect place in our health system. We have a lot of opportunities. If you honestly, you name it, and we'll find that perfect opportunity for you. There are just so many different things, whether it's working in a ambulatory space, working in an OR as you've showed this morning, working in the NICU like I did for my career. There are just so many opportunities, and I just think you'll really, really enjoy working for our health system.
And on that note, I have a final question. What does make it so unique and special to work for an academic medical center versus anywhere else?
Yeah, I think we're doing things that other places aren't doing. We're teaching the future, whether it's future physicians, future nurses, future lab folks, future respiratory therapists. It's everything. People are just learning here, and so you have that culture of a learning environment, and also we just are able to do things that maybe aren't done elsewhere because it's an academic medical center.
I like what you said. You're not just working, you're learning. Rachel, what are your thoughts on that? What can you let people know about the importance of working for an academic medical center?
Yeah, I think it's an energy like none other. We're doing cutting edge treatments, and I think it's really special when our staff get to talk to their patients who say, I've been looking for answers, or I had this really complex thing and I didn't know what my future held, and you and your team were able to help us. So it's academic medicine is like nothing else, and it's an energy and a really special place to be.
All right, let's wrap things up live at our OR with Alexis Del Cid.
Jess, one of the things that both the nurses I'm here with have been talking about is how incredible it is to work at a magnet hospital. I want to start with Ellen.
Yes, so we just recently got our 4th magnet designation, which just shows that our nurses strive here. There's a lot to learn, there's a lot of room for growth, and it's just a lot of opportunity and cool things to see and learn.
You both, Katie and Ellen, were excellent students. You could have gone anywhere. You're at the University of Kansas Health System. Why is that so special to you, Katie?
I'm actually from Southeast Kansas, and I had a nurse manager at another hospital tell me if you're moving up to the Kansas City area, don't go anywhere else but the University of Kansas Health System. You'll learn more than anywhere else, and it's the most hands-on. Our first year nurse residency program is an awesome program and exposes you to a lot of things, and I just couldn't imagine being anywhere else.
Wow. What a great sentiment from both the nurses here, and just what a cool gig this morning to be in the OR with these ladies.
Love it. Thank you so much. We don't mean to brag on ourselves, but but actually we do. We do. Great endorsement from those ladies. We appreciate all their work. Let them get back to it. Dr. Hawkinson.
Yeah. I mean, it's hard not to echo that. University of Kansas Health System. Why would you go anywhere else? We've heard and seen all of the compassion and the attention to detail that goes into taking care of all these patients and their families, which is extremely important as well. Just wanted to get to the point of, we can't stress and emphasize enough the point of vaccines. We know that the FDA and I think the CDC are going to be meeting within the next month, within the next few weeks, to determine about additional booster doses. Certainly we believe that maybe certain populations, like a certain age of 60 or 65 above, may be recommended to get additional booster doses. It's unclear after what amount of time. Also, what other comorbidities such as obesity and diabetes, lung disease, things of that nature. So we will be keeping up to date. We know that overall the cases are going down in the United States and the community, but it is still prevalent. The virus is still prevalent and circulating. Hopefully with the warmer weather, people will be doing things outside that will help decrease transmission. But most of all, now is the time to get vaccinated and to get up to date with vaccination if you haven't already. We know that even with Omicron, the vaccines continue to prevent and reduce your risk of hospitalization, and that's really the important goal here. Reduce your chance of having to come in to the hospital, having to go to the ICU, being on the ventilator, and of course death. And so right now, and I think Dr. Fauci talked about this maybe in the last couple days, right now is the time to jump on that individually and as a community. If you aren't vaccinated or up to date with your vaccines, continue to do that. emphasize to your friends, your family, to get vaccinated. We went through some numbers yesterday, Jess. I think we had 55 deaths in January. Only one of those people was fully vaccinated and boosted. We had 46 deaths in February. 2 of those people were fully vaccinated and boosted. We've had 1 death so far in March. Only 1 of those people were fully vaccinated and boosted. So the numbers, if you take that cumulative over the last 2.5 months, continue to support the fact that vaccination significantly reduces your chance of coming here and, most importantly, dying.
Yeah, that speaks for itself. Dr. Hawkinson, thank you so much. Okay, we are going to end on a positive update, a positive COVID update. You remember this couple, they joined us back in January here on this show, Thomas and Holly Eckler. They were unsure about the vaccine. Sadly, both contracted COVID, all while Holly was pregnant. She was so sick, she was on a ventilator for more than a week. When she came off of the vent, both were so thankful. They had gotten their answers. They had done so much research that when they left the hospital, they both left the hospital vaccinated. We just really appreciated them opening up, sharing their story, and helping other people know that it's okay to ask questions. But their message now is to please get vaccinated. Now we are proud to present baby Henry James Eckler. Without further ado, there he is. He was born on March 10th. I was actually in the middle of the show, and they texted me from the hospital and said, we're about ready to have little Henry James. So he was born healthy to 2 healthy vaccinated parents. So congrats to all of them from all of us. March 30th is National Doctors Day, and here's a way to say thank you to all healthcare workers. Many of you ask quite often how you can show your gratitude. On your screen right now is a QR code, so you can do just that. Just open your camera on your phone, hover over the QR code. It will take you to your email. Send a nice note, or you can record a 30-second video. You can share them with us, and then we will share them with others right here on air. And Alice from Topeka has sent in this video. She wants to send out some very special thank yous to her medical team. Take a listen.
Hi, I'm Alice Marshall from Topeka, Kansas, and I want to wish you a happy Doctor's Day. I appreciate the care I've been given, and I am glad that Lori Barbosa suggested I go and get checked. I want to show appreciation for Dr. Yacoub, Dr. Al-Rajabi, Dr. Al-Kaspouls, Dr. Vera Muccianini for helping me through my cancer challenge, and Dr. Andra for being a great primary care doctor. Have a great day.
Oh, looking great, Alice. Thank you so much for sharing your kind words. And thank you all for being with us today. Don't forget, you can always catch our shows anytime on Facebook, on YouTube, and now on Twitter. Coming up tomorrow, if you've been feeling fuzzy-headed and have been struggling to concentrate since you've had COVID-19, you are certainly not alone. Brain fog, well, it's not a medical term, but it's the name that pops up frequently in medical literature to refer to cognitive difficulties. The new treatment being used to clear the way for the future of people suffering from brain fog. We'll see you tomorrow for Open Mics with Dr. Stites. Everyone, have a great day.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.